Friends, today we have an oral surgeon who is going to enlighten us with a few norms and things which we must keep into consideration while attending patients post COVID. So, as we all know, there has been a huge shift in the way we see, and the transition applies to our beautiful domain, dentistry, as well. This conversation will for sure help us to prevent ourselves and even our patients from difficulties which could arise if we don't take the following things into consideration. So, my dear friends, let's welcome Dr. Kapil Rathore, an oral surgeon from Mumbai. Hi, doctor. How are you?
Yeah, I am doing good right now, enjoying rainy days in Navi Mumbai and eating pakoras. So that's wonderful. Let's keep things apart on rainy days. Yes, it's good going.
Okay. So, Doc, as we all know, this is going to be a short conversations with a few questions. Shall we begin?
Yeah, sure.
Okay. So, doctor, so tell us what all COVID has changed for a dentist. I mean, post COVID.
Yeah, Dr. Ravi, so many things have changed. Uh, we consider it as a pre-COVID, COVID, or a post-COVID era. Lot many things have changed from seeing a dentist in different suit to at present scenario. Yeah, so yes, definitely we need to change lot many things as the time is coming to us.
Okay. So as we all know, okay, there has been a huge responsibility on medical and dental fraternity, right? History taking is the first step before we begin. So, doctor, if you could tell us why history taking is crucial, especially post COVID for a dentist.
Yeah, doctor, as I mentioned, so many things have changed. So most of the doctors are actually not aware of proper protocols to be followed, because there are so many protocol which has come in existence. So there is, patient are all doctors who are there. They are also having thought of exposure, risk of contact. Then there is a fear of, getting how to see these patients. So these many things which we need to consider. Yes, let's not talk about the COVID times, what all we have done. But what is important right now is post-COVID management of patient. And yes, taking a history is very important. If we consider patient in two variants, that is patient who is non-COVID or patient who is COVID. So most of us all know what all to consider in cases where patient give a history of non-COVID, but still we do check temperature of the patient, oxygen saturation, breathlessness, diarrhea, and loss of taste or change or smell. All these things we consider. But right now, what we have to consider is patient who are RT-PCR positive, that is post-COVID. They are cured from COVID, but still they don't know certain things in their life which is going on. So we need to consider patients who are tested as RT-PCR positive, but still they are asymptomatic. Patients who are tested RT-PCR positive with hospitalization, or the patients who are RT-PCR positive and they were on self medications. So these things we do consider. So all those patients who are visiting to your clinic had a history of COVID. What is more important to us is something called as long COVID, which we need to consider. So patients, they are not showing any symptoms for first 3-4 months after the recovery from COVID. But there are certain patients who are having symptoms till 6 to 12 weeks or 6 months of the life, till the data what we have right now. We don't know, these symptoms may vary or may go up to years. So what we need to consider is long COVID, because whenever patient come to our clinic, they say we are recovered from uh, COVID, but they actually don't know what is going on in their body, because there are no much symptoms. So what all we need to consider is patient might have a problem of thromboembolism, patient might have some chronic kidney diseases, or patient sometimes in long COVID times may give a history of hair loss. So when patient come and speak to us and give a history of COVID, the problem is not there. Problem starts when the patient come and sits on dental chair, and when we start doing patient say that I am not able to breathe, or patient is having some kind of anxiety. So these are the things which actually leads to a problem on chair. So these are the things which we need to consider, whether it is a medical condition, what all things are possible after the recovery from COVID.
Okay, okay, perfect, perfect. I think there is a, good enlightenment on history taking. Doctor, my next question: what are all things or aspects which a dentist needs to check before starting a treatment?
Yeah, so let's, like as I mentioned that we should take a history. So basic history, whatever we used to take during post COVID times, sorry, during the COVID times, we need to add certain points to it. So the points which we need to understand is whether the patient who is treated from COVID in the form of self medication or hospitalization, we need to understand what all medications were given during the infection. Second thing which we need to understand is any kind of a specific drug which is given during the hospitalization. What all investigations were done during the hospitalization, and what all list of drugs given to the patient after the discharge from hospitalization. So these things which we need to understand before we progress to any kind of a dental procedure.
Okay. Okay. So also we've heard like there have been a drastic change in the glycemic investigation and hematological part in COVID. So if you could tell us
So,
how and why hematological and glycemic
yeah.
investigation are of great importance now post COVID.
Yes. So like as I mentioned, so when the patient has got COVID, there's all the system of the body are affected in one or the other way. But three important aspect which we need to consider is hematological aspect, glycemic aspect, and immunological aspect. These are the most important thing which we need to consider. So before starting the patient, as we say that documentation is very important, so we should take that history, that is the first part, and second part is the documentation, in which we should take the discharge summary of the patient, that what all things are there in the discharge summary, what all drugs are advised to patient after the recovery and discharge from the hospital, what was the glycemic index of the patient at the time of discharge, and what was the hematological aspect at the time of discharge. Why? The main important reason is the patient who had got COVID had three different type of hematological events which has actually taken place. The first is endothelial injury. So the COVID virus directly attacks on the endothelial uh, lining of the vessels, and it causes the disruption of endothelial walls. At the same time, patients who were immobile for long period of time may show stasis. So there is a stasis of blood. And the third most important thing which we need to take in consideration is hypercoagulability. So those patients who had shown history of COVID, the SARS COVID virus has actually shown a hypercoagulability state in patients who had suffered from COVID. And that is the most important thing which we need to consider in hematological consideration, because those patients who had a hospitalization or they were on self medication, they might have given some drugs in the form of either low molecular weight heparin or in the form of aspirin. At the same time, we also need to check a drug list, which in because there are so many newer drugs which have come, which patient is not aware and doctors are also not aware, which are given for the treatment of hypercoagulability. Coming to the glycemic part, when we consider a glycemic part, there are three types or categories we can say, where we can divide the patient. The patient who had history of diabetes, that is pre-existing diabetes was there with the patient. Second, the patients who had shown increase in the sugar level due to the steroid therapy which was given during the hospitalization or on self-medication. And third is post-discharge. Few patients had shown a increase in the glycemic level, because what happens is this particular virus, this binds to ACE2 receptor, and because of the binding of this virus to ACE2 receptor, there is the alteration in the metabolism of glucose, and because of this there is an increase in the rate or increase in the glycemic level of the patient. So patient post COVID is actually not aware that the sugar levels are high, but yes, it really makes a difference for us if we don't take a history of glycemic and we end up doing some surgical procedure, and there is, you know, delayed healing or a more prone to infection. So we need to take these two things into consideration when we come to a documentation. So glycemic control and hematological control, the hematological evaluation, these two things are very important. At the same time, we also should consider about immunological evaluation, because during the hospitalization in severe cases, there are certain drugs like tocilizumab or bevacizumab. These drugs are given to the patient which blocks IL-6 receptor or IL-6. Because of the blocking of these IL-6, the patients are completely immunocompromised. So a small dental procedure also may lead to some kind of opportunistic infection in patient who are cured from COVID, but they don't show any kind of symptoms post COVID, but they are not aware. So these evaluation must be done before we start off any procedure.
Okay, so doctor, if you could tell us if you have come across any such complication or same, something which you can tell us, which you can share us to our audience.
Yeah, like I have not come across any kind of a complication, but because I have made a new protocol at my clinic, taking a proper investigation history. But yes, recently I had got one patient who had come to my clinic with a grade 1 mobility. So patient was not aware of anything. He was just saying that I don't want to extract my tooth, but can you do something with it? So then I took a history proper in detail on each and every aspect. Then I got to know that patient is diabetic. That he said that I was borderline diabetic before I got COVID. So I have postponed the extraction. I have got the glycemic index done for patient, and surprisingly, I was the HbA1c value was 13.7, which is really not good. The FBS of patient was around 380, and PPBS was around 450. So yes, if you take consideration into the medical history proper of the patient, as well as the investigation part, you may not end up in any kind of a complication. But if you miss any of the points, the hematological, glycemic, as well as the immunological consideration or evaluation, might be you end up in some kind of a complication, because we don't know exactly what was the things given to patient during the admission of the patient as well as post discharge. So as I mentioned in the protocols, we should take a history of medication which were given during the infection. At the same time, we should what all investigations were done post discharge. So these are the two important things which we need to take into consideration. And yes, God grace, you will never end up in any kind of a complication.
Thank you so much. As you've said that definitely we need to take into consideration about the hematological part, about the glycemic investigation part, and also keeping into consideration about the immune system of a patient. So how important and what are all the investigation a dentist needs to take before a procedure, especially before extraction or going for a root canal or any extensive procedure?
Yeah, so I must say, like, along with the proper history taking, if at all patient gives an history of diabetes, that is pre-existing diabetes, we should consider a complete glycemic index of patient, whether patient is aware of it or not. But if patient is giving a history of COVID, we should get a complete glycemic index, that is HbA1c, FPS, and ppbs. These glycemic index, we should get it done, and depending upon the values, if we are getting it in a higher range, we should advise them to meet a physician and get a diabetic level under control. Yes, coming to hematological part, we need to get platelet counts, we should get prothrombin time, we should get activated partial thromboplastin time, then we should get D-dimer and fibrinogen. Yeah, so the patient who has recovered from COVID might show increase in platelet count, but that is not important for us as such. But prothrombin time, activated from partial thromboplastin time, and D-dimer is very important. Now, coming to the value of D-dimer, we should not be worried about what value patient has got post-COVID. We should see what all or how the things have changed for D-dimer, whether the D-dimer has increased after the discharge or it has decreased after the discharge. Let's say if we are getting a value of 800 for D-dimer, that is post discharge, but the value of D-dimer during the hospitalization or during the COVID time of patient was more than 800, so it has relatively reduced, but it is more. So we should be worried whether the patient's D-dimer value has increased post discharge. So that is most important part. In certain cases, if these values are coming on a higher end, in those cases we might go for von Willebrand factor or factor 8 investigation. So these are the most important investigation we should take into consideration before doing any surgical procedure or any emergency procedure.
Wow, thank you so much, doctor. I think this was a very insightful conversation. I am pretty sure that all the viewers on Wise Dentist or through anybody under the belt known as dentistry must be benefited with this. I thank you and I look forward hosting you again, maybe with some other topic again on Wise Dentist. Thank you so much, doctor.
Yeah, thank you so much, Dr. Ravi. It was my pleasure to give whatever small thing I know in dentistry, and I would love to learn from you also. So let's meet some other time again for a small topic.
For sure.
Thank you so much.
Okay, bye bye.